MD, DO, PA, nurse practitioner, RN, physical therapist, pharmacist, the list goes on and on. Opportunities for working in the health professions tonight on Call with the Prairie Doc.
Starting this season, we are offering a Facebook Live option for our viewers to still be able to watch the show during the regular broadcast times on Thursday nights and ask questions. All you need is either your laptop, tablet, or a mobile device, such as your smartphone, to view the show. Here's how to do that. First, log into your Facebook account. If you don't have a Facebook account, go to facebook.com and complete the information to create an account. In the search bar, type in Prairie Doc. Make sure to click like on our Facebook page so you can get updates and notified when we are going live. Each Thursday on the Prairie Doc's page, you will be able to see a live broadcast of the newest episode. You can also ask Dr. Holm questions via Facebook Live. All you have to do is ask your question in the comment bar and await a response. If you miss a show live on Facebook, it will be available later both on the Prairie Doc Facebook site or at prairiedoc.org.
Good evening and welcome to On Call with the Prairie Doc. The practice of modern medicine includes a wide variety of professional occupations, a virtual halo of assistance around the patient to cover all aspects of their treatment. First, let's take a look at this week's Prairie Doc Quiz question. By the year 2025, as the boomers graduate into old age and as the needs for healthcare in this group increases in the U.S., it's estimated that there will be a critical shortage of physicians. How many physicians would be needed to make up that shortfall? A, 25,000, B, 50,000, or C, 90,000? We will share the answer at the end of this program. Joining us tonight is Dr. Mary Nettleman, Dean of the USD Sanford School of Medicine, and Brock Rops, Educational Coordinator within the Department of Family Medicine at the USD Sanford School of Medicine. Thank you both for being here.
Thank you for having us.
This is a great opportunity. So we're going to talk about really the training and also all aspects of healthcare professions. And you know what you need to do to get in and why would you want to do such a thing and all of that. But before we get into that, Brock, I'd like to hear a little bit more about you.
Well, I'm South Dakota born and raised, so I know a lot about the prairie.
Where you grew up in?
I grew up in Lennox, South Dakota.
A Lennox boy.
And I'm living now back there in what I would call a little bit of rural America. And so we just, we love that lifestyle.
It's a Lennox Tiger, isn't it? Or what is it?
It's a Lennox Oriole, yeah.
Oh, Oriole.
But it's orange and black like a tiger.
Yeah, orange and black.
That's exactly right.
That's right.
And so grew up there, got into, went to college at the University of South Dakota and Mount Marty College, majoring in biology and secondary education. Graduated and taught 5 different lab sciences at the high school level before moving into the AHEC as an education coordinator position, and have been there for 6 years.
And we'll talk more about your project with pre-professionals in the sort of the FFA organization of pre-professionals in the state of South Dakota, but we'll turn to you first, Mary. So you're not originally from South Dakota.
No, but I got here as soon as I could.
Oh, that's a great answer.
That's what my bumper sticker says, actually.
Got here just as soon as I could. So you're originally from?
Michigan.
Michigan.
Mm-hmm. So born and raised in Michigan, medical school in Vanderbilt, which is in Nashville. I did my residency and fellowship training in Indiana University, and then 10 years at University of Iowa, 10 years at Virginia Commonwealth University, 10 years at Michigan State, and here I am.
So, and you're an infectious disease specialist.
Right, that's my specialty.
So you keep that, but of course you're the dean of the School of Medicine. I mean, that's just got to be a huge job.
It is. It's a very consuming job, but I have great people to work with, so it makes it really easy.
And you're married to a handsome and a wonderful man.
Yes, he is.
Yes, he is.
Yes, indeed he is, Scott.
I totally agree with that. And you've been here for how long now, Mary?
Almost 6 years.
So what's special about South Dakota School of Medicine?
Well, there are a lot of things that are special about it. One is, first of all, we're small compared to most medical schools. We take 71 students per class, and our curriculum is slightly different. We get people in front of patients sooner than most schools do. We integrate all of our clinical sciences, so a lot of places you do 6 weeks of pediatrics and 6 weeks of surgery and when you're doing clinicals, and we try to integrate it so you're doing everything every week as a medical student, so that you can't forget it. You can't just like binge learn one field and then just forget it and move on to the next, because it's important to remember things in medical school.
Yes, it is. And so all of them are blending.
Yes, they are blended together.
Now, I remember 2 years of medical school that all I did was sit and do memorization. Then the second 2 years, I had to leave South Dakota and go to Atlanta.
Right. You were part of the
finish it.
Old two-year school, yeah.
Because we only had a 2-year school at the time, and then you got your clinical feet wet, which I thought was a wonderful part.
Right, but now we do it slightly differently. First of all, there's no more than 17 hours of lecture a week, and usually less than that, and that's by design. There are 2 half days that are not scheduled, so students have time to schedule within the work week. And all of the different learning is designed to try to embed it in people's deep memory, deep in their memory, so that they can't just forget it and dump it out again. But when they have to think about hepatitis, they can turn and pull that out of their memory and use it.
So this kind of individual blended education kind of started in Yankton, South Dakota.
Yes, it did.
Partly because of necessity. That's what they had. They had the
Partly, although they could have done the old-fashioned model, I think they were just innovative. And it is called, its official word is the Longitudinal Integrated Curriculum, but nationally it's referred to as the Yankton Model. In fact, internationally it's referred to as the Yankton Model. And most medical schools have some variation of that on at least one of their campuses now.
Now, the Harvard people are trying to call it the Harvard method.
Yes, we could refer to the Harvard as the Yankton of the East.
Yeah.
Yes, I know. So, but it was the Yankton group that started it, and Harvard came in there. In fact, a large proportion of the medical schools in the country have actually visited Yankton, South Dakota, to see how it's done. Dr. Lori Hansen, our campus dean, leads that effort there.
And it was a lot of Lori's creativity that brought it to happen.
It was. And,
it really was.
Yeah, it was. And now the whole school is on that type of a curriculum.
Yeah, we are really, they call it the 3 pillars now.
We call it 3 pillars instead of 4 years. So the first pillar is foundational sciences. Do you understand, the foundation of medicine? And the second one is really getting more medical knowledge. And then you get into more advanced skills where you are learning subspecialties. You're delving in more into an area you think you want to spend your life in. So our curriculum allows students to get experiences before they have to actually decide what they want to do, whether they'd be a surgeon or a family physician or something else.
Or an internist.
Or an internist.
Like you and I.
Like us. And,
So,
and an internist is an adult medicine specialist for the audience.
Doctors for adults. As
Doctors
some
for
would say.
adults, yes.
So, Brock, so your training has been in biology, and then you were hired to be a coordinator of what was going on in family practice in Sioux Falls.
So I was actually hired through an AHEC, an Area Health Education Center, which is a federally funded program that really looks to reach out into communities. Our focus really is to get healthcare professionals to work in rural communities. And something that we had come across then in my hire was this Host of Future Health Professionals program. That's a nationwide program, and our state was not affiliated with that. So we found out from our state Department of Education just how much interest is there from students in that health science field, and found that it's the second largest career cluster interest. And therefore, we felt we needed to pursue getting this started in the state of South Dakota. And so we started it, we've got our charter in 2012, 2013.
So this HOSA thing is talking about, it's sort of like FFA in high schools, but it can be in colleges too.
Sure.
And it is pre-medical health professions of any kind.
Of any kind. When I travel around our state, and we've got 30 chapters statewide, our smallest chapter is 13 in Hoven, South Dakota, or 15 in Iroquois, and then we'll have chapters as large as 100 in Harrisburg and 70 in Dakota Valley. But really, we're trying to get students to understand just career awareness. Number one, what is all out there? Because most students think healthcare and they think physician, pharmacy, nurse, and that's the end of it.
Right.
So trying to get out there just the entire spectrum of healthcare careers is number one, and then number two, trying to basically knock down these walls of I have to be a 4.0. That's not true, or I feel I don't have the resources here in this small community, and
That's
it's just not true. And so trying to really build confidence in these students to pursue whatever career path that they choose, health-wise.
You know, if you're from Holden or if you're from DeSmet, where I'm from, and let's look at the pictures. Tell me a little bit more about this, Brock.
So every year we have an annual state leadership conference held in Sioux Falls.
These look like babies. These are babies.
Oh, no, they're young adults.
So young. They're so young.
No, I'm sorry, that's your perspective, Rick.
I keep getting older, and they seem to keep getting younger. And so this is a picture of us at the Sanford Pentagon, who actually hosted our event. So students come there to compete in over 50 different events that are healthcare slanted.
So we had it in Sioux Falls?
Yes.
The national meeting?
No, this would just be the state.
This is our state meeting.
Dakota.
Yep,
Lots of
that's
people.
South
And here they are examining a funny-looking dude.
That's exactly right. That's in the Perry Simulation Center at the School of Medicine.
So, you know, I sense that if you're going to bring somebody to DeSmet to practice medicine, or to be a nurse, or to be a phlebotomist, or to do healthcare of any kind of form or shape, you really need to really come from DeSmet, or you have a whole lot higher chance of coming back to DeSmet if you started there.
I personally believe that. I feel if a student feels that they've gained their confidence, they gain their start, whether it's they're 15, 16, 17 years old, they know that community best. And I feel that they feel like they've got a really good start there as a high school student, that the likelihood of them returning to that community to raise a family and to practice there increases.
You know, and your response to those comments about where people go to practice, if we're going to practice rural health care,
Right.
how important is it that we draw from the rural
Oh,
kids?
I think it's very important. And I think it's not just even drawing from the rural areas. I think it's training people in the rural areas to the extent that we can. Because medicine in a rural community is a lot of fun. But it's a slightly different thing than it is in a city where you might have specialists all around you. And so getting that confidence is really important. So
Right.
we consciously provide opportunities for our students to train in rural areas. In fact, the entire class has to do a required rural experience in family medicine.
That's we should get into that, and
Right.
we will in a little bit, but let's do this first. Beginning in the mid-1960s, a new program was developed to take advantage of the field training and the experience of former military corpsmen and educate them as physician assistants to fill a shortage of primary care physicians. In 1993, the Sanford School of Medicine added a physician's assistant program to their offerings. What does this mean for the future of medicine in South Dakota, both rural and urban?
So I think the easiest way to describe physician assistant is, and what they do is to say PAs practice medicine. And PAs practice medicine in a whole host of areas within the healthcare field, right? So the common one that historically started the profession was really about primary care and getting PAs into primary care to practice medicine in a primary care setting. But clearly PAs work in primary care and PAs work in multiple specialties across the spectrum as well. So it's different from being a physician in that the training is less, right? PA profession or programs in and of themselves are somewhere between 24 and 28 months in length, kind of in the average. So students come in with typically they come in with an undergraduate degree. Typically that means a biology degree or a health sciences degree, and they all have some level of experience beforehand. Every PA program in the country is modeled after the medical model. Which primarily means the first phase or the first half of the program is the didactic phase, or the kind of the basic science foundational coursework that they need. So gross anatomy, physiology, pharmacology, clinical medicine, those kinds of things. And then the last half of the program is all about clinical rotations, or the supervised practice of medicine. So they spend 12 months, minimum of 2,000 hours over that 12 months, practicing in a variety of, or practicing under supervision in a variety of medical settings. And then after that 12 months, they graduate. PAs don't do a residency program, and the other difference is that PAs always work with physicians, right? So PAs have collaborating physicians that they work for and with. The interesting thing is right now we're dealing with a healthcare provider shortage, but 50 years ago when the PA profession started, it started because there was a healthcare provider shortage. That's why the program exists. When it started in the first class enrolled in 1993, we were established because there was a healthcare provider shortage, especially felt in small, underserved communities in the state. That's our mission. That's why we're here. That's why we exist. And so that's the niche that we try to help. We try to help fulfill and fill that niche within that rural primary care setting, as well as the needs of the entire state. And there was a rural health education study that was done a couple of years ago that looked at the proportion of PAs practicing in rural areas and where those students actually come from, or those practicing PAs, where they came from. And South Dakota ranked 12th in the country in the production of PAs in rural communities. Clearly that's our mission, clearly that's where the need is at, and that's where we want to produce PAs.
So PA school, it's right
Yes.
within the School of Medicine as well? I
Well,
mean,
it's in our sister school, the School of Health Sciences, but yes, it's on the campus, yes.
It's on the campus. And his comments about the history and roles and so on and so forth, what would you reflect as an important point to underline?
Well, I think it's a team approach. You began by saying that there is a shortage of physicians, and there is a need for more than just physicians and more than just what physicians do. And PAs play a very important role in doing that. They work alongside physicians, they see patients. When you go to your doctor's office, you might be seen by a PA for some things, for example, or a nurse practitioner.
Right.
And so that is, I think, the modern way, and probably most people in your audience have gone into a doctor's office and seen somebody in one of those two professions.
Right. Any comment of, you're part of the family practice?
No, I mean, I think out in rural South Dakota, you've got issues that are going to have to be filled. And you mentioned before about the baby boomer population, and it's a double whammy in healthcare, because not only are these PAs or nurse practitioners or physicians retiring as they get older, but they're also going to need more healthcare, which is just a big vacuum. And so we've got to have these future health professionals available to fill this void.
Well, and it's kind of scary, you know, and of course, as a
Right.
retiring physician at this phase of my life, I've got to have somebody take care of me. And who's going to do that?
Right, right.
Not going to be me, you know.
Well, and people aren't going to go to PA school if they don't know what a physician assistant is, right?
Right.
And so that's, I think, where HOSA comes in.
Yeah. What about the idea of the training of PAs? He said the medical model.
Yes.
What does he mean by that?
Oh, he means that it starts with the foundational sciences, learning about medicine, learning about medications, learning about the function of the human body and how that all works together, and moving although they also have clinical experiences early, but then moving strongly into the clinical experiences toward the latter part of the training. So that's similar to the medical model of first getting your feet on the ground and then learning and practicing your skills, if you will.
Right. And of course, that's, I think the part of my training that I think about was the mentorship. You know, the
Yes.
time that I'm hanging with somebody and I learn by example. And I remember saying to myself after 5 or 10 years of practice, I wish I could go back and shadow 5 or 10 doctors again and see what I'm doing right or wrong. I mean, I've got students shadowing me. I hope I'm doing the right thing. I'm hoping that I'm doing the right thing.
I am positive you are doing the right thing.
I made every effort to try to to do the right thing, and part of it is because you are helping someone who is in need.
Right, right.
And you just have to be the very best you can be.
Right, and
when you're
our
doing
school
that.
takes only people who are from South Dakota who have incredibly strong South Dakota roots. So, I mean, the people who are practicing from our school worked with people, you know, and now when they were training, and now feel that they can give back. And in this state, it's likely to their neighbor's son or their, you know, cousin's wife's nephew or something like that. So it's definitely a, you know, we rely very heavily on the rest of the state to support us, and they certainly do.
They do, don't they?
Mm-hmm, they do.
So let's talk about this organization, the HOSA, a little bit more. I kind of want to get into that. So we were about the latest. We were about
Yeah,
the
so
last.
there's 48 states actually. There's a couple that still aren't on board, and we became the 47th, and North Dakota became the 48th state. And really trying to get students to understand when they hear PA, like they think PA system. Or they think, you know, and when you that's exactly right. Or when they hear physician assistant, they think, well, I don't want to be an assistant. I want to be my own. You know, there's just this miscommunication on what actual careers are, and even you know, even to get into the conversation about careers that aren't even available yet. When we start looking at genetics, and we start looking at careers that aren't even here yet, and what's on the horizon, and really personalized medicine and those types of things, you know, it's just an exciting time for a high school student to get involved and get their foot in the door and understand before they graduate from high school, which will save them time and money later on in their academic journey, just to better understand what's available to them.
Right. So now you've gotten involved with the organization itself. Tell us a little bit more about that.
Yeah, so I was fortunate enough. I was asked to apply to get on the board just 1 year in, and
The
just
national board.
the national board,
The national board
which is run out of Dallas, Texas.
Now that stands for HOSA stands for
Health Occupation Students of America. But because we've grown so much, we're in Canada, and we're in Mexico, and we're in Germany, and so they had to change they had to change their brand to basically reflect HOSA, because people wanted to hold on to the history.
Right.
And then added this Future Health Professionals, which really signifies what we're trying to do, is to create just a better candidate, or build a better candidate for whatever career path they decide to go into.
Right. So you were on the board for a year.
On the board for the year, and then kind of how it works, I moved into a secretary of the board, and then into not the chair role, or as a chair, and then I'll go immediate past chair starting in January.
So
You ran the place.
you ran
ran
it.
it.
That's kind of neat.
Yeah, well, it's
Good old-
some big shoes to fill, and there's a lot of goings on, and obviously when you oversee an organization of over 200,000 members, that's a big business.
Yeah. Do people from Lennox really realize what's happened there?
Well, I don't want to go with
We're
that
proud.
kind of deal, but
Well, we are proud.
I
And-
certainly am excited about the role I play, and just the vision. I'm a visionary. I try to be innovative in what we do, and every year we're trying to tweak, like, what can we do better as just a host organization. And I do selfishly look out for our kids first, and what South Dakota HOSA means, and the mission and values of what we have here. Just like every state's going to be different. What's really exciting is watching representatives from the state of South Dakota go and compete and attend an international leadership conference, and being able to be with peers from across the United States and even beyond that, and to meet kids with the same career goals. You know, somebody from Alabama, somebody from Hawaii, somebody from Germany. That experience, it just lifts them to a whole new level. And then another thing is, it's global. I mean, you're going to compete globally, not only to go to college, but to, you know, in a career, just for a job. And so they need to just get the best education they can.
Oh, there it is. I was doing some preparation for this show, and I was looking at rural versus urban. And I know that urban is towns greater than 2,500. And smaller than, from 2,000 to 50,000, 2,500 people in a town to 50,000 is kind of a borderline micro-urban area.
Okay.
Less than 2,500, it's urban. You're out in the country or you're
You
in
mean
these.
it's not urban, it's...
I mean, it's rural, right,
Rural,
right.
rural.
So you're rural if you're in a town like De Smet, less than, that's 1,600, and or you're out in the country. So if you look at the country, the United States of America, we have 85% of the land is rural, and 15% is urban. 15% is urban, right? But of the people in the United States, 85% are urban and 15% are rural. But if we go to South Dakota,
Yeah, that's a different thing, yeah.
50% are urban, 50% are rural. We've got a very high percentage of rural, higher
Yes, we do.
percentage than almost any place. Maybe a couple that are more rural than we are. But it's important if we're going to provide access to health care in our rural area, we've got to draw our students from that rural area.
Absolutely.
There it is.
Absolutely.
And that's what you're
Absolutely.
doing.
Absolutely. And something that, kind of, we look at, and we're trying to get students to get certifications, whether it's as a high school student, what can you do? Well, you can become a CNA, or you can become an EMT, because the EMT shortages in our state, it's just, it's awful. And trying to get a high school student at 18 years old to get their EMT is something that's going to bode well for them down the road. And so there are things in place that we're doing to alleviate some of those issues.
They didn't have EMTs when I was going. I remember trying to get a job on an ambulance crew. And so what experience have you had? Well, I've not run in an ambulance crew, but I had no access. I
Right.
didn't have any
Right.
way to get into that. Let's talk about our School of Medicine, though. I
Okay.
know that we have, I'm a real fan. I mean, I've been from
You've
the
been a big
beginning.
supporter. Mhm.
Yes, and so what are the interesting things that we can say about our rural commitment? How do we do on training people to be in rural?
So first we draw from rural areas. 44% of all of our students are from rural areas, which for us is a town of less than 10,000, not near an urban center. And we also track, and they track nationally, where people ultimately practice. And so we are at the 98th percentile, almost the top in the country for the proportion of our graduates that actually do practice in rural areas.
Wow.
And sometimes we're number one in the country. I don't know who we're competing against, but anyway. So we have a big emphasis on that. So we draw from those populations, as you say, and we also try to train students in those in rural areas. And as I said, 100% of our students have some rural experience during their medical school.
Let's talk about the rural training.
Yes.
I mean, we have a farm program.
We do.
Tell me about the farm program.
So when we say farm in the medical school, we mean the Frontier and Rural Medicine Program. And this is where a student can spend 9 months of that very important first clinical year in a smaller town in South Dakota. So Millbank, Mobridge, Parkston, Winter, Vermilion, Spearfish, Pierre, gee, I hope I didn't forget one. And so those are the training sites, and they train with the physicians who are there. They are embedded in their communities, they do community projects, and they learn rural medicine from the ground up, and they do really well on their boards. They get excellent training. It's been a very successful program, and it's very popular. We have more
People
students
wanting to
do it than we have spots for them right now.
But the interesting thing that you're telling me is that they do well in the boards.
Oh, yeah, they do
I
fine
mean,
in the
it
boards.
proves
Yeah.
that they're not getting lesser training out there.
Not at all.
They're getting a
No.
lot more hands-on, really, aren't
Right.
they?
Yeah, they are getting very much hands-on training.
We had 3 years of family physician residence at the Brookings Clinic back 20 years ago, something like
Yeah.
that. And they all stayed in rural areas.
Yeah.
And one stayed with us, and she's wonderful.
Yeah.
And but we lost it because the money for the support for that went away.
But we have something new, something brand new, funded by the legislature on the recommendation of the governor and the primary care task force. There will be a rural family medicine track in Pierre, South Dakota. So they'll do 1 year in Sioux Falls with the Sioux Falls Family Medicine Residency and 2 years in Pierre, South Dakota.
Yeah, that's really neat.
That's good. We're so excited.
Some of my buddies from Pierre are just thrilled about it.
Yeah.
So we'll talk a little bit more. I want to talk about that award that we have. We'll do that in a minute. With all the various opportunities, it may be difficult to decide in which area you would like to work. The South Dakota State University College of Nursing can help you research possible fields of study.
Well, there's a lot going on in health professions at SDSU. Of course, we have nursing, which is really our College of Nursing. That's what we do, and we do it well. But we also have a College of Pharmacy and Allied Health Professions that includes not only pharmacy and the PharmD, but medical laboratory science, as well as a Master in Public Health program that is collaborative with the University of South Dakota. And then we have dietetics, exercise science, athletic training. So we have multiple health professions that we prepare.
So there's been a concern, off and on over the 30 years, 35 years that I've been practicing in Brookings, about enough nurses being trained. And some years, oh my goodness, we're way behind, and then some years we've got enough. I'm wondering where we're at right now.
Well, if you think about the population demographic that's growing the fastest, those who are 85 years and older, and that won't change for at least 2 decades. We know that nurses are going to be very much in demand. I did receive information from a national study that's done every 5 years at a recent conference. It's not out yet, but there is a tidal wave coming. And in fact, it's already there, the shortage.
So talk about the different advanced practice nursing roles. What are there?
Well, advanced practice registered nurses are graduate prepared with a graduate degree, either a master's or a doctoral degree. There are 4 roles for advanced practice registered nurses. A nurse practitioner, the one that's most familiar to people, and there are multiple specializations. And then clinical nurse specialists. That was such a great role for the acute care system and for transitions to primary care. It started in the 70s. Advanced practice nurses who are CNSs are integrated into primarily larger health systems and acute care settings. Then there are certified registered nurse anesthetists, now prepared at the doctoral level, and of course certified nurse midwives. Well, in terms of research, nurse scientists have been around for about 60 years.
Okay, so there's the scientist nurse, there's an education nurse too, is there not? Explain that.
Well, we can't have a health care workforce without the educators who prepare them. Think of all the healthcare professions. Nursing has led the way with preparing health professions educators because we've needed to. But South Dakota codified law actually specifies that in order to be an instructor or a faculty member in nursing, you have to have a master's degree or a graduate degree in the discipline. We also have online options that are accessible from a distance in this vast rural state. The healthcare workforce in nursing cannot meet demands if we don't prepare enough nurse educators. And nurse educators and the administrators in nursing are at the forefront of a national shortage as well, so it's synergistic.
So isn't she a great lady? Thank you, Nancy, for that. Brock, let's talk about nursing, training for nursing, or the enthusiasm that you hear out there in the high schools about going into nursing.
Well, a lot of students, they understand nursing, and then that's the end of it. The fact that you can work in so many different areas of nursing is a surprise to a lot of students. And where they want to work. Most students, well, I want to work where I can deliver babies, or I can work in a not necessarily delivering, but being in the suite there. And I give them the reality of you do understand it doesn't always come out right, and are you able to handle that emotionally? Another thing is just as nursing as a platform to launch into a different career is just such a wonderful place to start. Whether you're going to be a nurse anesthetist or whether you're going to move into nurse practitioner or whatever the case might be.
Or sometimes go to med school.
Absolutely,
Some do.
absolutely. And a lot of students don't understand that pathway, and we're just trying to enlighten them to that.
So I have a son who is a nurse and a wife who's a nurse and a nurse practitioner. I'm surrounded by nurses at my house.
You're blessed.
I am blessed. I just think about the times in the night when the nurse would call and say, we're in trouble, I need you here.
Yep.
Or the nurse would call and say, you know, things are fine, but I need this and I can't do it without waking you up, and I'm sorry, but you know, and I needed to make absolutely sure that they knew they could wake me.
Yes, have to do that. Absolutely.
And but they're the ones that are with the patient and knew the most, and I leaned on them my whole career, no question about it.
Being married to a nurse, I mean, she gives me plenty of advice, and of course, I am.
Oh, does she?
I am not a very good patient, and she lets me know about it. And I tell you what, she's certainly right more often than she's wrong.
You're right. So let's talk about the award.
yes.
You know, so the AAMC is what organization?
It's the Association of American Medical Colleges.
So it's your club. I mean, it's a
our
club.
All the
of
medical
of the
schools in the country belong to this. I guess you
AAMC.
could call it a club, but it's an organization.
And what do if they belong? Do they get accredited by them?
No, they belong because it is the group of everyone. So we all get together at different meetings. I mean, all the deans get together, and we have the council of deans. There's a lot of functions they run. The match. They are part of the people that do accredit medical schools. But no, if you belong, you also get access to a bunch of data. Some of the data I've been talking about comes to us from the AAMC.
Okay. So the AAMC is it's sort of like the American College of Physicians, the internist club.
Right.
But the AAMC is the deans and the med schools.
It's all the medical schools in the country, all the MD schools.
So they give out awards. I mean,
Right.
Probably a fair amount of awards.
They
every
give
year.
out different awards, yes.
And
So-
what's happened with South Dakota?
So we got, they only give one award each year to a medical school. They give individual awards, but they only give one to a medical school, and they consider it, and many do consider it, the top award that a medical school can receive. It's called the Spencer Foreman Award for Outstanding Community Service, and it recognizes a medical school that is fulfilling its mission to its constituencies.
Right.
That its communities, and that the communities are giving back to the school, which they certainly are here. And this year we won it. And we
won
are
the
so
award.
excited, yes.
So it's this. So congratulations on that.
Well,
I
thank
mean,
you. It was definitely a team effort.
Right, and here is what is this picture?
Well, that's us accepting the award in Boston, there are 7,000 people at this meeting. This is the black tie dinner that goes with it, and these
Yes.
are our South Dakota friends. And Dr. Marcia Rapley, Dean Marcia Rapley, is presenting the award. Actually, I shouldn't say Vice President Marcia Rapley is presenting the award. She is a physician, and she was originally a nurse, as you were talking about.
There we go.
And she she's the head of that organization right now.
So we'll put that in the case and stick it out in front for everybody to see. I mean,
we're
how
so
proud
excited.
we must be for that.
Well, and you'll see some billboards going up thanking the communities, because we are very small. We consider the whole state to be our community, and the whole state turns out to support this medical school. We couldn't do it without the support that we get from everybody in this state.
Well, it's an endeavor that is done as a group. It started as a
Right.
group thing. I remember when I was at the end of my sophomore year, before I graduated to go to Emory and finish the School of Medicine. At that time, I only had 2 years of school. I spent a week in Madison with Dr. Mugley, and that was the most enlightening, shocking, unbelievable clinical experience. But it's those doctors in that community teaching me what medicine was like.
Yes, exactly. That's real medicine.
And they continue
Yeah.
to do that kind of a thing
They
throughout the state.
continue to do
don't they?
that, and our students excel because, first of all, we take South Dakotans only, or people with strong South Dakota roots, and those are great students, but also because they have fabulous mentorship and teachers.
Yeah. So, any other issues that we want to make sure that we talk about on the School of Medicine? The Helmsley Award or the Helmsley research that recently come out. We need to talk about that.
Okay.
But I do think that there are a lot of things that we can talk about the School of Medicine and what it does. In particular, I think your presentation at the State Medical Association meeting last time, you talked about where students were at the end of 2 years, at the end of 4 years, and at the beginning.
Right.
And what's happened? What happens with their progress?
Well, there's a lot of progress that gets made over the time. There's some ways our students take boards, like every board examinations, like everybody else, and our students right now, 95% to 100% pass on the first try, depending on the board. Our board pass rates are all at or above the national average. Our board scores are at or above the national average, and we're taking. Remember, 44% of the class grew up in a town of less than 10,000 in South Dakota. So these are, when you said people who grow up in small towns shouldn't, both of you said, shouldn't feel ashamed of it, that's where we're getting a lot of our talent from.
Yeah.
It's really, really good. So there's a big maturation that goes on. People have to learn not to just memorize a fact, spit it out and forget it, because you're supposed to remember that stuff. You want your doctor to know something about the liver and not to have forgotten it in the first year of medical school. So it's a different process. There's almost a transformation that occurs among the medical students, and it's hard to do that. It's hard to transition from being a college student to a medical student.
It was sort of like, okay, now I'm going to dedicate my whole life to this one thing. I'm not going to have any other life. And I studied my head off. I really did.
Well, but we are working hard now on student wellness. Physicians have a high suicide rate. What is it? 3 or 4 medical school graduating classes, large medical school graduating classes, have to graduate just to replace physician suicides every year. So we
need to talk about why that is.
Yeah, well, and so we're trying to not create burnout by the time the students graduate, and so the students themselves are very much participating in this. Dr. Pat Manzera has helped establish this program, and there's a lot that's going on with the wellness program. We intentionally allow white space on scheduled time during the thing. I can't make medical school easy, but I like to make it something you could get better, so you could get out and see.
And be a well-rounded person.
Well, our students are twice as likely to get married and twice as likely to have children as the rest of the country.
Oh, that's interesting.
Yeah, I mean, they're a lot. I mean, over half the class is usually married or about to get married by graduation, and over a quarter have at least one child. So they have a lot on their plate.
There is a lot on their plate.
And they are doing very well on the national boards. So.
Brock, you tell us, or respond to that comment about suicide being high in physicians. That's a little bit scary to think about that.
It is. I mean, just to speak at the secondary level and what students are going through, something that we feel we can fill just from a counselor role is, in a utopian society, a school is going to have a counselor for career planning and a counselor for the personal issues that go on in a student's life. Well, that doesn't exist in very many places, and so the career counseling kind of gets pushed to the back burner because the personal counseling has to take precedent, and that makes complete sense, and that's what has to happen. And we're just hoping to become, just as a HOSA program, is trying to lessen the burden on some of these counselors who have to do both of these very important jobs, and kind of being, if you have someone who walks in your door, a student that walks in your door interested in healthcare XYZ or career XYZ related health, and just send them our way so we can help you do that.
Right. I think about the stresses in medical school and the hours and the workload, and then the stresses out in practice. But I have to think that a guy couldn't have a better job.
No, I would agree with you. Me too.
It's been a wonderful job that I've had, and I can't imagine. I think it had to do with the selection of the people going into medicine more than it is the medicine itself that would bring on that suicide rate.
It's when also people don't feel they have a choice. They feel like they're working way too hard, the hours are way too long, and they don't feel, for some reason, that they can step back. I get it. I understand why that would happen. It is. I mean, there are a lot of, as you say, stresses on physicians. just like there are a lot of stresses everywhere, but the physician rate is higher than the national average.
I think that there are certain kinds of people, though, sometimes could be drawn to the field of medicine. Some of that are the OCD kind of people that are so tight, so tightly wound, and that might lend itself to stresses that are inappropriate. And I have often thought that the acceptance of people in the medical school has been too looking at the grades and not enough looking at that well-rounded, balanced, bedside manner, positive kind of person.
Right, and it's hard to predict because many of them haven't been under that kind of a stress. It's partly the ability to forgive yourself. Yourself is the hardest person to forgive, right?
Yes, it is.
Because you're going to screw up. And sometimes if you're in medicine, that's going to make a difference. And so you have to be able to move on. I mean, it's not, you know, it's something that will stay with you, but to be able to find a way out, to be able to step back, those things are skills that we're trying to at least give some foundation in for our medical students.
I had a date with a girl when I was way before my wife.
Good, I'm thinking.
And I had a date with this girl, and she said, "Oh, for a med student, you're not quite as out of balance, out of sync." That's what her words were. Out of sync. You're not quite as out of sync as the rest of them. She was a nurse, and she dated a bunch of med students. And the point is that I think to try to be in sync with, you know, the humanity of it all is something that we need to try to.
Well, it's so important to just have, I mean, it's work-life balance, and a lot of times I haven't been in that situation in terms of a medical student, but just to understand your priorities and trying to keep that in balance. And so when that gets out of whack, I'm sure the stress can really pile on.
Yeah.
And sometimes things are out of your control. I mean, you have a test coming. If you're a student, you have a test coming, and this happened and that happened, and it all compresses down into time, and it's difficult. When I found out that our students were more likely to have children, I found that they weren't asking for maternity or paternity leave, and I said, well, why not? They said, well, we didn't know we could. Yeah. And so, you know, because it was their idea that they should keep working, and that was our fault. That's on us. We should have made it clear that not only should they, but could they, but they should, and we can arrange it so it doesn't extend their medical training almost at, you know, in almost any way. So part of it is on us.
Those words, though, would have driven me to find a girl, get a baby, and have some time
Really?
off. No, I'm just kidding. Just kidding. Just kidding. So let's talk about other health professions. Nancy Farrenwald talked about nurse practitioners.
Yes.
Now, let me have your take on a little bit of the blowback from the recent legislation that allowed their independent practice versus the way it was before.
So PAs are work in collaboration with a physician, as we've said. Nurse practitioners now have the ability to set up independent practice as as primary care providers without having a physician supervision present. So that is a different way of doing it. It's not uncommon throughout the country. And South Dakota has done that, and it is something that is going to move forward, and I have the greatest respect for nurse practitioners. So I think that this is something that obviously any practice of medicine needs oversight, and needs good oversight and good data, just like we have for all the medical professionals in this state. So,
you know, and that's my take too,
Yeah.
is that physicians need to have collaboration. Nurse practitioners and PAs need to be collaborating. We all need to be constantly collaborating. And that is happening.
Yeah, that is happening. Certainly we don't want silos,
Right.
because that turns out to be really bad. When the team doesn't communicate with each other or
Bad.
communicates in a dysfunctional fashion,
Yeah.
it's really hard to give
And when a
appropriate care.
physician's in a silo, that's a bad thing.
Right.
10 seconds, Brock, last words.
Well, I just thank you for the opportunity for being on the show, and think the host of the program is a wonderful program to get involved in, especially if they're thinking a healthcare career. Most small communities have students involved in everything, and that's kind of the pushback I get. But if it's a career thing, I think it should take precedent over some other things.
Thank you both so much. And now for the answer to tonight's Prairie Doc Quiz question. By the year 2025, as the boomers graduate into old age and as the needs for health care in this group increases, it's estimated there will be a critical shortage of physicians. How many physicians would be needed to make up that shortfall? A, 25,000, B, 50,000, C, 90,000. The answer is C, greater than 90,000 physicians shortage coming up. So encourage someone to attend medical school. We need all the help we can get. We'll be right back after this.
Because they want you to be there for the many milestones yet to come. Because you don't want to miss out on the little things. There are many reasons to get life-saving cancer screenings. 1 in 8 women will be diagnosed with breast cancer in her lifetime. But regular self-exams and mammograms can catch it early when it's most treatable.
Promise?
Promise. 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 Promise.
Make the promise to get screened. Do it for the people you love. For more information about life-saving screenings or available financial assistance, visit getscreenedsd.org.
As part of our Prairie Doc volunteer work to spread science-based public health information, we have gathered a group of pre-professional college women and men to help us. Almost every Thursday night at 7 p.m., 6 Mountain Time, these young Prairie Doc Assistants answer telephone call-in questions for our TV show on PBS. This changing group, initiated by our friend and advisor, Mr. Judge Kelly, has been helping us for more than 4 years. These kids not only help answer phone calls during live shows, but they help research medical topics and even help others during medical mission trips. In return, we give them the opportunity to meet our medical guests for 30 minutes before the show, and we help them find shadowing experiences with physicians. They need to experience a taste of what it would be like in medical school and in the real world after starting practice before they commit to it. The first 2 years of medical school for me, back in the 70s, required putting my nose into books, memorizing how the normal human body works and understanding what can happen when illness strikes. The second 2 years and the internship and residency that followed was learning from an older and experienced master who taught by example. This mentoring type teaching is a lot like the medieval way of learning, like being a silversmith's apprentice with an artisan who knows what he's doing and who guides you in making your first silver tea service. In medicine, I think the hands-on, one-on-one mentoring experience is what matters the most, but the book learning part is still necessary. Now, med schools are mixing together the book learning and the mentoring throughout the 4 years, which is a better deal. During my life of medical practice, I have had many apprentice nurse practitioner students, PA students, medical students, and medical residents, all while I was caring for patients. I asked the patient permission first and very rarely had anyone say no to having a student in the room. How else are they to learn how to listen, examine, and think in their quest to become a high-quality caregiver? Besides, having a student watching can only make a doctor try harder and be better. Now, I find myself encouraging college students into the glorious and rewarding field of medicine. Indeed, what an honor it has been to have a treasure chest of knowledge that can be used to help others. A big thank you to our guests, Dr. Mary Nettleman and Brock Rops with the USD Sanford School of Medicine, for traveling to our studio in Brookings. Thank you very much. Their experience brought great depth to our discussion this evening. Well, that does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. And with the ongoing support of these individuals and institutions, Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen District Medical Society, Black Hills Medical Society, 3rd District Medical Society Brookings, Madison, and Flandreau, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications.